Hi, Dr. Barker here at Peak Plastic Surgery. So we've been getting questions lately about how do you know if your plastic surgeon is taking advantage of you? This is a very new kind of hot topic, especially with the onset of social media, everything being a lot more transparent in terms of people's experiences, whether going to a consultation or through a consultation and the surgery and recovery process. Understanding this really hot topic question of is my plastic surgeon taking advantage of me? This is very unique when it comes to the cosmetic plastic surgery side of medicine. When we're looking at other type of surgical interventions, we're not really talking about the cosmesis of it, meaning if a scar is located in your belly when you're getting your appendix out, nobody cares how it looks. It just depends on if that appendix came out, you healed from it, and you had no complications. Cosmetic surgery is different. It depends on how it looks. It's not only the surgery, it's not only the recovery, it's not only how it comes out in terms of overall appearance. It comes out to how do I feel about my results from a patient perspective. This is where this key comes in with this question. How do I know if my plastic surgeon is taking advantage of me? This might not come into play with just money. This also can come into play with giving unrealistic expectations. So understanding this actually is a very unique and personal question, meaning trying to understand if somebody has your best interest at heart comes in with meeting them, getting your questions answered, feeling as though you were heard through the consultation practice or process, and then as well as understanding the reasonable expectations that were given. If you can have all of that securely in place before you have the surgery, that should never be an issue. The way I guide my patients through our consultation process is I make sure that they feel as though they were heard. So I am not 100% telling them you need this because otherwise you will not like how your body looks. I need to understand what are their goals. How do I achieve their goals for them with a customized surgical plan? Then after I understand that, then I give them the expectations. This is what I expect it to look like. This is the timeline I expect your recovery to take. This is the timeline in which I expect you to get your results to see the final outcome. Not every surgery is the same. Not every patient experience should be the same. Not every patient wish and goal is the same. This is where you're going to find out. How do I know if my plastic surgeon is taking advantage of me? It is a personal feeling. Do you feel like you were heard? Do you feel like you were pressured? Do you feel like your goals were addressed? Do you feel like your plastic surgeon that you had your consult with or their staff was telling you how you should feel? These are the small indicators that can give you a sense of feeling confident and comfortable in not only their skills, but also their approach and their recommendations. If it ever comes to the point where you are wondering, how do I know if my plastic surgeon is taking advantage of me? I always recommend get multiple consultations. Get the feel for the surgeons, get the feel for the staff, get the feel for their facility. This is how you can make your decision knowing I have done my homework. I feel like I was educated. I feel like I was informed, and I feel as though my surgeon heard me. This should be how you can avoid being taken advantage of, not only monetarily, but also in recommendations and results. So again, this is a very hot topic question. How do I know if my plastic surgeon is taking advantage of me? We all hope that never happens. But if that is a feel you get, you should have more consultations. You should feel comfortable with your decision and your surgeon. If you have any other questions for me here at Peak Plastic Surgery, please reach out. Let me know. I'm always happy to address them. Thanks.